Good morning, good afternoon, good evening. I don't know what happened there. I guess I just pressed the wrong button. I'm so sorry, guys. Today, though, without wasting our time, it's Dr. Unathi here, your host. I have two guests for you. To my right, I have Dr. Tambe Elvis. Dr. Tambe is hailing from Cameroon. He is actually a medical doctor, obviously, and he has masters in risk management and public health from Vrije University in Belgium, Brussels. Thank you so much for joining us, Doc.
Thank you.
Thank you. And to his right, it's Dr. Okehe Ifyong. You know her. She's been here before. Dr. Okehe, she is a board-certified pediatrician and a certified brain health coach. She basically deals with kids. And more so, her special focus is kids that are vulnerable, kids that need homes, foster care. She has her private organization. She deals with that. Thank you so much, Dr. Okehe, for joining us. Today, we
Dr.
discuss
Nati.
about kids. It is my favorite topic because I'm a mom, and I know that Dr. Okehe, she's a mom too. So I guess that's why her specialty is in kids. And obviously, Dr. Tambe loves kids. Obviously, that's why he's here.
Yes, sure.
All right, we're gonna start right away. So today, our topic is effects of drug abuse and alcohol in our children's brain. So, how do we preserve our kids' brain? I have these wonderful guests that will tell us and unpack things that we need to pay attention to. I was reading articles and I was quite pleased with the fact that there was a young girl from high school who actually wrote an article who was looking at the stats between now and back in the 90s. And actually, there's not too much bad stuff occurring in kids. Children are more aware, parents are talking more with their children. So that was an impressive stats to me. And they were basically looking at comparing the drug abuse and obviously alcohol abuse from now and then. That's impressive for our kids to be aware and avoid these things. Dr. Tambe, tell me, what do you see in your practice? Tell me about kids' experience and also drug abuse or alcohol. What do you see?
Yes, thank you very much, Dr. Nati. Um, Actually, I'm going to get back to the basic of alcohol or drug abuse on the state of the brain of children. All of this boils down to before conception. So women who are preparing to get pregnant, they have to be aware of the impact of what they are doing on the brain of the kids that they plan to have. For example, the consumption of alcohol by a pregnant lady, or even before they get pregnant, we know that it's going to have a direct effect on the brain of the child, the unborn child. And even the use of drugs, cigarette smoking, or some other drug, cocaine, or all the like, they also have direct effects on the brain of the child. And that's why before you get pregnant, or even when you are pregnant, you have to be the women, they have to be aware of this effect on the brain of the child. So we come across this during daily practice in the hospital, where children born of parents that have been involved in the use of alcohol or the use of drugs during pregnancy actually cause retardation, brain retardation. And most of the time, these children have problem in learning, behavioral problem, and interaction with their peers. It's very difficult. So it's something that women especially have to be aware, especially when they are pregnant.
Yes, you're so right. It's interesting that one time I was actually in Uganda doing some medical volunteer work, and I was blessed to work with an organization with children with cerebral palsy. Some of them were struggling with mental retardation due to Down syndrome, or there was also fetal alcohol syndrome where the children were exposed to alcohol. And the sad thing about that organization, they were a home to children who were abandoned by their parents. So basically, in Africa, there tends to be this belief that a child that is either has cerebral palsy or mentally retarded or some limitations or things like fetal alcohol syndrome, where they were exposed to alcohol, their parents, they abandon them. They feel that they are bringing bad luck. That was basically the main reason those children were there, we abandoned them. The parents were saying, yeah, no, I don't want this child. He or she is affecting my marriage. My husband wants to leave me or left me because of this. So I don't want her or him. So those are the misconceptions, unfortunately, in Africa, we want to eradicate. Thank you so much for touching on that. Dr. Okehe, what do you have to say? I know that you see this every day too.
Yes, and we're seeing it more and more even where we work because of all the drug use that's coming on with a lot of unemployment, which leads to drug use. But of course, the thing is, once it has occurred in infancy, or in conception, like Dr. Tambe said, then unless that generational issue is addressed, then the kids who were born with having been affected by drugs are most likely going to do the same thing, and then it just continues on and on. So that's something, like he said, to be aware of, and it's not the child's fault, Parents, we have to look at ourselves and say, okay, what is it that we need to change about what we're doing? And okay, what have I been exposed to and what can I do different so that the next generation doesn't continue the same problem?
Right.
Because there are things that you can do to help the children who have been affected by drugs. It just takes intention and the willingness to work with them. So.
Awesome. Yes. You know what? Now you are taking me to your favorite topic. Dr. Okehe, I know that in the recent years, we all know here, together with Dr. Tambe, that things have changed in medicine. What we learned in med school has evolved in the recent years. Do you guys want to talk about this recent study that is mind-blowing out there by Permanente, case of Permanente and CDC, talking about how we need to look at ourselves, our past, like you touched on the past here. Do you guys want to touch on the effects of our past? I would like you to take me through that study because it has been fascinating to me, and how it affects our kids and just generally the generations to come.
Right. So Kaiser Permanente did a study in the 1970s. Actually, no, not 1970s, in the 1990s.
Right.
And they've looked at about 18,000 middle-class Americans just to see what their past experiences were and what their present experiences were in terms of what they experienced as children, if they experienced any what we now call adverse childhood experiences. So, for example, those are things like being exposed, living in a home with a family member that's using drugs, parents who have been incarcerated in prison, living with parents who have mental health issues, being traumatized either emotionally, sexually, physically. So what the study found, which was quite shocking, was that how common, first of all, the adverse childhood experiences are. So it's not a matter of those people over there, it's anybody, the rich, the poor, everybody in between can be exposed to adverse childhood experiences. They just may not talk about it. As we Africans know, we typically don't talk about things that are traumatic. We hide it under the rug and nobody talks about that. We just pretend it's not there. And so they found that when you have 4 or more of those experiences, it sets you up and you're 12 times more likely to kill yourself. You're more likely to have chronic diseases like diabetes, heart disease, just because you've been exposed to childhood experiences. Now, if that number is 7 times, so if you have 7 or more, there are about 10 of them or more. But if you have at least 7 of them, then your risk like doubles or even triples.
Yeah.
And so it's and they also, and of course we know about epigenetics, which is if a mother, like you said, Dr. Tambe, is exposed to either she has violence in her relationship or she has drug abuse or whatever happened to her or whatever she does herself, then it makes changes in the DNA. And so that child she gives birth to has already had abnormal changes happen in their DNA and in the genes. And then it's passed on to this kid who comes up, and then we start to see issues with the kid. So that's why it's so crucial for us to look at what happened in our past, because it absolutely informs our future, it informs our present, it informs the way our children behave, even if it didn't directly happen to them, because it happened to us. And if we don't be aware of it and take steps to heal from it, then we're just going to repeat the cycle. So.
Wow.
Okay.
Dr. Tambe, you want to say something? Because I know that I was actually impressed when I saw that you deal with public health. What do you see in Cameroon? What's out there, and what's the awareness the governments are doing in terms of doing all this awareness? Because this is real. In Africa, this is real. Like,
Yeah.
okay, say we don't talk about these things. There's so much domestic violence in Africa. There's so much sexual abuse. Children are told to keep quiet because this will bring shame to the family. You know, we know what I'm talking about, guys. So what do you see, Dr. Tambe, there?
Yes, so it's something that the environment where we live is plays an important role, because most of the time children get engaged in this the use of drugs or alcohol consumption based on the people around, based on the interaction that they have with friends, with others.
Yes.
So it's something that is if the parents they don't really control the behavior of the child, it's they can move around and get involved in activities that their parents are not even aware of.
Yes.
For example, if you stay, for example, in a neighborhood where there is like increased use of drugs or alcohol consumption, if these parents don't really take care of their kids, control their movement, these children are going to get involved in this type of activities, because we all know that the very important in the development of kids, the first 8 years, for example, are very crucial, in which if the parents and they don't really pay much attention in controlling these children at this particular age, they will become something else, especially with respect to behavior. So the first 8 years of life, they are very, very important, and it's something that can predict the future of the kids.
Wow.
Yeah, and it's in Cameroon, for example, there is no actual restriction on the, I can say, on the purchase of drugs or alcohol. For example, you can send a kid to go and buy maybe cigarettes or drugs. Nobody can like say no, don't send that kid. But in some countries, for example, in Europe, there is restriction. For example, if you are not an adult, you cannot go to the shop and buy maybe wine or alcohol, any alcohol containing product. You will not. It can never be so.
Yes.
So it's something that we really have to look into.
Yes.
Yes, because there is restriction actually. If you are not an adult, you cannot buy
Mm-hmm.
alcohol from the shop.
Yes.
Yes, that's how it is here. So it's something that we really have to to think and develop in our system, because back home in our countries, you can send a kid to go and buy alcohol, and the business people, they are excited to get their money, and there's no restriction.
Right.
Yeah,
Right.
so it's something that is very, very important.
You know what? Now, to be honest, I've seen this growing up. There's children that were sent by their parents. And in Africa, there tends to be this language: don't do what I'm doing. Don't do what I'm doing. Go and get me this cigarette. Go and get me this bottle of wine or beer. But we need to understand here as parents, children are curious in nature. They are wanting to explore, like Dr. Tambe is saying there, that first 8 years, children are learning. Children, I always say, they are photocopies. They photocopy, they are taking videos of whatever is happening in front of them. So if we're going to say, go and buy me that beer and don't drink it, I've seen children, even friends or maybe even adults, that share that when they were sent for that beer and they were asked to go and drop it, they used to go and kind of take that sip,
Yes,
right?
sir.
So it starts there, and the thing is, I would like you guys to actually comment on the addictive personalities, because I remember one time I actually challenged my panel one time about how people think it's your choice. You an alcoholic, you chose that. I would like you guys to comment on the addictive personalities. How does being an addictive person, because a lot of times people don't understand that relation, that you could easily be experimenting and then you are hooked. We've seen that.
So
And another person could experience that and be okay and not even be addicted and just did it once and that's it. There's people that today are alcoholics that started when they were young because they have that exposure of addictive personalities.
yeah. So for children are sponges, so they will literally do everything you do. So you're absolutely right. We as parents, it goes back to us always. We have to take responsibility for what we're doing. We can't say don't do this and we're doing it. They're obviously not going to listen. So I mean, especially when your child has already been exposed, meaning if in their genes from the parents, there's already parents were alcoholics and changes were made in their genes, and so then they're at higher risk because there are receptors in our brain where the drugs will attach to that gives you the high, and then you just want to keep getting that high. But then if you're already susceptible because of your prior exposure plus your environment, then that only just sets you up to be more hooked on the drug than somebody who has never been exposed to that before. So they are
Right.
less likely. I mean, it can happen, but the
Yes.
chances are higher for the child who has already been exposed from generations and it just keeps getting passed down. So
Right. I like that generational part because sometimes it's not even about the immediate parents. Alcoholism or drug abuse addiction could be an uncle, an
runs
aunt,
in the families. Yeah,
a
it runs in
grandfather,
families.
a grandfather. And unfortunately, in Africa, sorry, we still lack in terms of collecting stats. I would like to hear about the stats. Also, Dr. Tambi, as a public health specialist, I would like to hear about the stats in general in Africa. I find I don't see much stats in terms of what is out there to make these things aware. Like, I mean, if our populations in Africa generally, if we don't do these stats, people won't be aware. Where are the campaigns? Where is education on drug abuse and alcohol? Do you want to comment on what Dr. Okay was saying?
Yes. So addiction actually is something that you know regarding alcohol or drug. If you've not done it, don't do it, because by the time you start, it's very difficult for you to quit.
Yes.
Yes, so it's something that if you've not started it, don't just venture to start, because it's something very difficult to quit. And even with the help of medical assistants or specialists like psychiatrists, it's something that is very, very difficult to solve. I've seen people who are smokers, for example, and they're begging, they are struggling to quit, but they are not able. You see somebody that has a zeal to quit, to stop smoking, but the person cannot stop it because it's already in the system. And even with the help of medication, is something that is also very difficult. So I would say that is we really need to create awareness on the impact of the use of alcohol, drugs on children, and the and even the adults, because adults are related to the kids, and it's something that is just all related. So there's no like clear distinction between that. Okay, we focus on children or you focus on adult. Everything is related.
Yes, yes.
Yeah.
Before we start making our viewers curious, do you guys want to comment about, now a parent is suspecting my child might be abusing drugs? What symptoms must they look for? What must they look for in their kids? Okay, I'm suspecting my child might be abusing alcohol or drugs. He's or she's hanging out with these kids that are known in the community that are abusing these things. What must they look for?
So you would look for changes in their personality. So they may become, they want to stay by themselves more, not interested in the things that they used to be interested in. They just like sometimes you're talking to them, they seem like they're spaced out, and you may think, oh, maybe it's just a teenage not paying attention. But if you already have that the suspicion, then you want to take that a little more seriously, and maybe looking for things going missing in the house, because sometimes they can start stealing because they need to pay for the new habits they formed, or to keep their friends happy, or whatever the case may be. So just changes in behavior. So that's why it's so important for parents to be attuned to what's going on with the child, even if they're growing older. This is when they need you the most, because yes, they may act like they don't, but that's when they really need you. So those are the things I would say to look out for.
Yes.
And again, the performance of the child in school is also very crucial, because these are all things that affect the learning and also emotion. So sometimes the teachers in school can be in a very good position to report to the parents some type of changes in the behavior of these kids in school. Yeah, so so parents also need to work hand in hand with teachers to see if there's any abnormal behavior in their kids.
Awesome.
Yes,
Yes, thank you so much. And also, in my experience, I've seen either maybe they have bloodshot eyes. There's that poor eye contact, when you're talking to them. And also, suddenly they change their friends. I always say when I talk to my preteen son, show me your friends. That's basically the principle of how to assess how your child is doing. Show me your friends. If you don't know your child, this is a challenge to all parents who are watching here. Always, all the time, know your children's friends. Who is your child hanging out with? What type of children does he play with? Because once your child starts hiding, then there's something. Like Dr. Okay and Dr. Tammy was saying, what is this behavior? Is it something different? My child was always, upbeat, and also, and you know what? This is interesting because also there's a thin line when a child is going through adolescence. There's hormonal changes. There's also that that withdrawal. So we need to be present. Basically, you guys are saying we need to be present. All right?
Exactly.
Yes, yes. So now tell me, now let's be practical. Your child is exposed to alcohol or is exposed to drugs. What is the next step the parents should do?
So when your child is exposed and you've confirmed that they are, I would talk to them, and see, like, just try and get to the bottom of what, if you can find out what they're doing, like the type of drug, if you can find out how it started or where they're getting it from. And then I would seek help also, because a lot of times teenagers that are using drugs are also suffering from self-esteem issues, and not feeling confident enough, and maybe they feel like they need to be like the group, the whole peer pressure thing. So if you can find a really good counselor who can work with the child to get them back, I mean, in coordination with the parents, definitely, that usually helps. Somebody that they can talk to and not feel like they're being attacked, because the last thing you want to do is attack them. It just drives them further away. So
Yes.
it's a matter of saying, okay, so we know you have this, so, and explain why it's important. Remind them of what it is they've told you they want to do. So if they tell you, I want to be an engineer, you say, to be an engineer, you need to keep your mind clear. And if you use drugs, it does dampen it. I mean, it decreases your brain function. So if we can address it that way versus attacking the child and pushing them away further, then we're more likely to get help for them.
Thank you so much. Thank you for mentioning the not attacking part, because I know in Africa, I love parents there. They are amazing, but we need to start respecting our children. The respect we look for from our children, we need to also address them with respect. I find there is that imbalance in Africa. There's that seniority, that elder thing, and then parents could throw their words anyhow. And like Dr. Okay is saying, once you start attacking the child, then he withdraws or she withdraws. She will not say anything. So we need to be vulnerable. We need to be vulnerable to get to the core of what bothers them. And actually, I would like you guys to also comment, Dr. Tambe, on the use of that alcohol or drugs. It could be probably underlying, there could be depression there, there could be anxiety there, right?
Yes, yes, actually, because you know, generally some people think that when you're into depression or you have something very difficult in life, you you get maybe alcohol or drug and use, it's going to suppress or this the stress that you're going through. So if somebody is getting into this the use of this drugs or alcohol, it's very important for us to know why, to know the root cause, the reason why this person is getting into these activities. Because if we are able to tackle, to attack the cause, the main cause of this provoking this individual to get into the use of these drugs, it will help. It also play a role to help solve the problem.
Yes,
So,
yes,
yeah, so that's why, as Dr. K said, it doesn't like suffice for us to just go and attack the kid. Why are you taking drug? Why are you doing this? Why are you doing this? You have to use a diplomatic, I can say, like a diplomatic approach to solve the problem. And it also requires the involvement of a counselor, of it can be a psychiatrist or child abuse specialists, work hand in hand with them to solve the problem.
yes, yes. Are there any available rehab centers where you are in Cameroon? I know that in South Africa, I'm from South Africa. I mean, there are centers, but I don't find parents accessing. We don't have much population of kids, and yet kids are out there. They are struggling. Is there a cost to this? How is the access?
I can say in Cameroon we have mostly the psychiatrists, and we also have um, psychologists that can also help give advice to parents that have problem with child abuse, related to child abuse. Even though there are not many, but they can still be found.
Okay.
I think the problem is lack of awareness, because most of our parents, they are not aware of the fact that if a child is having a problem with addiction or with abuse, alcohol abuse, drug abuse, they can get assistance from this specialist.
Yes.
So So it's very important to create awareness, about these services, because sometimes the services are there, but people don't use them because they are not.
Yes. So basically,
And also the stigma too.
yeah.
Sometimes the stigma, yeah.
Yes, we
Because
still very
mental health in Africa is viewed as, I guess, you're crazy or you're possessed with something.
yes,
And we
yes,
don't want to address the root cause of what it is, which must be as simple as I just don't feel good about myself. How about that?
Yeah.
yes,
And I'm not possessed by something. So I
absolutely.
think that's where it is. And yeah, we have to keep up appearances. The whole we have to look good for everybody else. That drives a lot of it too.
True.
Worried of what people would think if our kid is known to be going to see a psychiatrist. I guess that's why there's not that many of them. I don't know.
Yeah. You know what? Actually, I kind of was very fortunate. I worked at a rehab unit where I saw quite a number of young kids that were troubled, and actually, the drugs had already affected them cognitively. These
Yes.
kids were brought in by their parents because they were not coping in school. They were concerned by the teachers, and the sad part is most of the kids I saw there, they were coming from middle class families where parents were busy, parents were too busy to care. And a lot of times I know that I want to comment actually for the parents here to pay attention to this. I know that in Africa, people they tend to be able to afford people that help us in their families, and then they automatically think those helpers should take over parenting. And the unfortunate thing, a lot of children are abused by those helpers. This is the
Right.
they
Yeah.
they are abused, and you are out at work, you come back in the evening, you come home, and you don't even know what your child is experiencing, and he or she is exposed to this person every day. And like you said, in Africa, people don't talk about these things, and then that's where this child could start doing drugs for coping because of stress, right?
Right. Because
Yeah.
they feel like they can't tell their parents. Their parents may not listen or may not believe them.
Yes, there's a lot of that. And also,
Yeah.
they keep pay attention to what time are you giving me time? Are you giving me time? Are you attentive to what I could tell you? Because a lot of times kids, they can't trust even their parents, or they're not even used to. Have you noticed that some children, they are more used to their helpers, the helpers in the family more being close to their parents, which is sad. And I see that a lot in the African families. And I mean, I still see beautiful relationships between children and parents, but I think we could improve in terms of spending more time with our kids. All right.
Right.
Yes, I don't want to take time, and I'm enjoying this conversation with you guys. Today, I want to actually give a chance to our viewers. There's questions there. I'm going to pull them up so that you guys can address them. So, someone here, Torai Verueta says, unite, not dictators. I love that. Let us not dictate to our children. We better unite, come together, and unite so that you can get the history you are looking for from your child. Greg says blessings. Thank you.
Yes. So with blessings, it's really important what you say to your kids.
Yes.
And there's
Because
something that is very important to know, that when parents are into drugs or alcohol, the kids tend to suffer the effects, even assuming that the kids are not into drugs or alcohol, but they tend to suffer the effects of that, because sometimes with the poor behavior of these parents, is actually going to affect these kids
Yes.
in one way or the other, because they are there to copy what their parents do. So if the parents are into drugs or alcohol, all their behavior, the bad behavior that they have, they are going to copy them.
Absolutely.
Yeah.
Yes. As we guys said in the beginning, they copy. They copy us. Do you want to say anything, Dr. Okahe?
oh yes, I completely agree with him. So I was actually saying, and just to follow on that with blessings, when I saw the blessings comment, it's so important what we say to our kids, because what we say to our kids can make the difference between them doing the right thing and the wrong thing, because kids, like we said, are sponges and they latch onto what we say about them and they believe what we say. So if we say good about them, even if they're not acting the way we want them to, but we keep telling them that, oh, I see, or they overhear us saying something good about them to someone else, then they're more likely to do that.
Yeah.
Versus if we only point out the wrong and that's all they ever hear from us, because that's what that mentality, that's I'm the parent, like up here and you are down here. That's typically what happens, is you just keep telling them when you pay attention to them, it's when they do wrong. So then they're more likely to do wrong to get your attention. And so then it just spirals out of control. And then you wonder what happened. Well, it starts with the way we talk to our kids and what we say to them. So
thank you so much. Power of positive affirmations, basically. We need to speak those beautiful affirmations to our kids. Angela says, greetings all. Thank you so much, Angie. Musonda says, let's unite again. Let's unite again, like fighting freedom again. Absolutely. Thank you. Kasati says, cigarette smoke contains many chemicals that are harmful to both smokers and non-smokers. Breathing even a little tobacco smoke can be harmful. Of the more than 7,000 chemicals in tobacco smoke, at least 250 are known to be harmful, including hydrogen cyanide, carbon monoxide, and ammonia. Guess what, Kasati? I love what you just mentioned about non-smokers, which is basically called secondary smoking. I would like you guys to comment on that, docs, because reality is a lot of times parents, they would be smoking. I've seen even here in Canada, I see parents smoking in the car with their kids in the back. Or parents have smoked inside their homes generally. And like Kasati is saying, even if you're a non-smoker, you guys talked about medical conditions like COPD, like lung diseases, and lung diseases and stage lung disease could occur from being a non-smoker, but you were smoking because your parents were smoking in front of you, you know?
right. So yeah, so I tell my new parents, the ones, especially the ones that smoke, I say, okay, so where do you smoke? And they say outside. So I say, okay, so do you clean up? Do you take a shower? And they're looking at me like, why? And I say, well, the smoke it's all over you. So a lot of them wash their hands. They think that if they wash their hands, then they're fine. But the truth is, smoke is in your hair, it's in your skin. You carry that baby, the baby inhales it, baby starts having respiratory problems before you know it. And I'm like, okay, so I just tell them outright, if you're not, you might as well just sit in front of the baby and smoke into their face, because it's either you make the changes or you do something different. But essentially, you're still exposing your child. So I found that when I just put it plainly like that, they're more likely to be like, oh, because they are not aware that just washing hands alone is not enough to get rid of the smoke.
It's not enough.
And all the changes it makes to the child's brain and the child's lungs too. So
yes. And a lot of times things like asthma, a lot of children, it's because of the exposure to chemicals like Kasati was saying, smoking. A lot of times parents underestimate, and we've seen bronchiolitis, children in winter time, even in summer,
it worsens. Yes, definitely.
Because of the exposure to smoke. Tepo says, yes, abusing of our body by alcohol is bad indeed. Absolutely, Tepo. Thank you so much. And Dave Nabuara says, I'm watching. Thank you. Thank you so much. Kasati says again, listen to your children and read between the lines also. Sometimes they tell you things that a friend of theirs is doing, when in fact he or she's actually speaking about themselves. That's powerful, hey? There's always an underlying issue that causes depression, drug and alcohol taking, and suicidal thoughts. Love and non-judgmental care is needed in counseling. Thank you, Kasati. Yes.
Yeah.
This is exactly what we are talking about, right?
Yeah. It's very important.
Very
and
important.
the aspect of non-judgmental is very, very crucial, because if you start solving this type of problem by judging, it's very difficult for you to get through. Yeah, you have, as I said,
Resolution.
I remember I said you have to use a diplomatic approach
Yes.
in solving this type of issue.
Yes, yeah, I remember that when I read
Mm-hmm.
his comment. Yeah, we need to be very non-judgmental and more compassionate and loving. And Kasati again says pharmaceutical drug abuse is very prevalent too. Yes, painkillers, anti-anxiety drugs. Thank you. Thank you. You know, we are starting to see children abusing narcotics. There's here in Canada, there was a surge of deaths from fentanyl. Fentanyl, children were dying like as young as 14, 15, 16, and of course adults too, from the painkillers. He's so right. And the sad part is the fentanyl they were taking or they are taking is all fake. It's all fake. Even if they were taking the original one, it does kill. So that's
Right.
so true. And of course, the anti-anxiety drugs, we've seen people taking the Ativan, the lorazepam, which is not good for the muscle of your heart, your brain. It can easily
Yeah.
cause respiratory depression. I love that comment because what if you, as a parent, can you guys comment about how parents should take care of their painkillers, their anti-anxiety drugs, so that kids do not have an access to that?
Definitely lock them up. It's no longer enough to just have a medicine cabinet that can be opened because we're seeing little kids end up in the ER with overdoses by mistake.
Yeah.
So it has to be locked up.
Yes. Yes. Absolutely. Because truly, we've seen kids committing suicide because they took their parents' pills, not even sometimes painkillers, even generally pills. Junior says there's nothing good about smoking. Maybe smokers can come on board and tell us the benefits of smoking. Junior. So that's all from our viewers. Okay. We're coming to an end of our conversation. Dr. Tambe, do you have any word for our viewers? What can you tell them to take home for their kids?
Yes, addiction actually is real, and it affects every individual, including children. So parents and everyone should be aware of this and stay away from alcohol, from drugs. And for those who have not started, they should not start, because once you begin, it becomes very difficult to quit,
Yes.
even when you have the zeal to quit.
Yes, you're so right.
Yeah.
They become hooked and difficult to reverse. Dr. Kehe, do you have a word for our viewers?
So my word is please love your children by spending time with them and paying closer attention to exactly what's going on with them and not leaving it to the hands of whoever you have at home to care for them, because children are sponges and they are going to take from whatever the example is that they see. So whatever change you want to see in your child, let it start with you, and then you see the change in your child.
Wow. Thank you so much, Dr. Tambe and Dr. Kehe. This was
And
beautiful.
there is one thing that I forgot to say.
Yes.
Is somehow common in most villages, where pregnant women generally they are being given some alcohol. So I don't know why. I don't know if you experience it in your women that are pregnant. They usually encourage, or even breastfeeding, they are usually encouraged to take palm wine. I don't know if you.
No, never heard of that.
Yeah, so it's like it's more of a myth, which is something that is very bad, as we said at the beginning. Alcohol, especially in pregnancy, is very, very bad because it's going to directly affect the brain of the child, and with this is going to cause retardation, is going to cause learning impairment, and so many other problems when the child is born. So yeah, so there is no alcohol or wine, palm wine, that is good during pregnancy. So
Eye-opening. I was never aware of that behavior, and I'm actually putting it down so that viewers can see it. No palm wine, parents, or alcohol. Right?
yes,
Yes. Wow, I didn't know that.
yeah, it's
What is it for, Doc? What are they given for? What is the benefit?
sorry.
What is the benefit when they give, like when the pregnant women are given this? What is it for?
No, I think you did not get my point. I said it's a myth. It's a
Yeah.
myth. It's a myth in most villages where women are being encouraged to take palm wine or alcohol that it's going to help the child. That's why I'm trying to discourage such behavior because it's more of a public health problem.
Yes.
Yes, so you cannot give alcohol or palm wine to a pregnant woman and think that is going to benefit the baby. No, it
Yeah.
has serious effects on the brain of the child.
Right.
Wow. Thank you so much for that awareness. I think we actually need to come back here and talk about these myths and more especially the traditional medicines and how they could affect brain's child actually. I think that's another topic for another day to discuss the traditional medicines, which I love most. I know that they have a part in our traditions in Africa, but there's an overuse of these and they have an effect on the children's brains.
Yes.
Thank you so much again. I'm so appreciative of your time. I'm hoping to bring you guys again next time here. There's so much we want to talk about in Africa. And actually, I'm hoping in September to discuss a topic that is very close to my heart. And I would like to bring you to the parental alienation syndrome. It's humongous amongst people in general, where another parent, where they are struggling, either by there's divorce looming or separation, another parent speaks badly of another parent to the kids. It is so common. We see it a lot, more especially when people are fighting for custody of the children. They speak badly about the other parent. It is 150% wrong. It affects children's mental health. So stay with us here. Thank you so much to our viewers. Thank you so much. Stay with us, and I would like to see you again next week.
Thank you.
Thank you.